Um, Hi, everybody. Welcome back to my podcast. This is Arun Gala. My podcast is called Grabbing Coffee with Arun, where I interview interesting people. Oh, I said that wrong. Where I interview everyday people that are doing interesting things. Anyway, my guest today is Kristi Chapman. Kristi is an occupational therapist, and I know we hear that term a lot about what's occupational therapy, what's physical therapy. But I'm just going to ask Christy some basic questions about what is occupational therapy. And she's also a certified hand therapist. Just to start off with, Christy, welcome.
Thank you.
Um, Tell me a little bit about what does an occupational therapist do?
So, an occupational therapist is a therapist that uses function for their treatment. Okay, so a physical therapist and the occupational therapist different in different ways. The physical therapist is has their scope of practice is kind of a little bit more focused on, I guess you could say, biomechanical kind of frame of reference. And the frame of references that are used in occupational therapy are more in the psychological kind of frame of references that deal with mental health and things like that. Okay.
Hmm.
Occupational therapy can vary from working from a kid on a horse walking through a field
Hmm.
to helping someone in their final stages of life.
Hmm.
So in everywhere in between. So there's many different settings that an occupational therapist and a physical therapist can both participate in their careers. So an occupation, let's take a this is an example. So if you had a stroke
Hmm.
and you were incapacitated and you were in the hospital, the first person in the morning that you would see when you're in the hospital for months at a time would be the occupational therapist. We're there to help you with what's called activities of daily living. We call them ADLs,
Hmm.
okay, which is dressing, bathing, cooking, cleaning, grooming, toileting, driving,
Hmm.
everything you do with your arms, those are what you do is basically your activities of daily living. You take care of yourself. You get up in the morning, you brush your teeth, you comb your hair, you wash yourself, you get your clothes on and off, you toilet yourself, you fix yourself breakfast.
Hmm.
You're able to have the cognitive ability to use a microwave or whatever you're doing. You have the ability to reach up into the refrigerator onto the top shelf with a bad shoulder to get the
Hmm.
milk or something. You
Right.
have the ability to, clean your house. You have the ability to do your laundry. These are all activities of daily living. So then occupation, you think occupational therapy, you think, oh, that has to do something with their job, right? That's what
Right.
everybody, oh,
Right.
you help somebody with their job. No. Occupation, what is your true occupation in life? Is using your arms to do
Right.
the things
Right.
that you need to do, which are called ADL. So that's your true occupation. That's what occupational therapy kind of comes from doing. Okay.
Kind of taking care of yourself and stuff.
Yeah, and it's called doing. Like that's the you rehab yourself through a purposeful, meaningful activity or task.
Hmm.
Versus when you're in physical therapy and you have a bad knee problem, you flex and extend your knee up against gravity 10 times,
Hmm.
3 sets of 10. I'm saying that's a different kind of way that is differentiates between physical therapy and occupational therapy. Now, not to say anything bad about occupational physical therapists. They totally incorporate many things that have to do with occupational therapy into their practice as well, which is amazing. So um, because we have to work together. It's a symbiotic kind of relationship
Kind of, it
between.
goes in hand, I guess, right? You
Yes,
can't,
kind of a little
you
bit.
need,
Yeah,
but I guess a doctor to determine what kind of help you need, or whether
that's
you need
right.
occupational
So if
therapy or
you have a
physical
knee
therapy.
problem, you would get both physical therapy and occupational therapy, where an occupational therapy would like see you in the hospital and assess whether or not do you need a walker, or do you need a something that was in the bathtub for you to sit on while, because you can't stand, or do you need grab bars, and the things that can accommodate a patient. That's what occupational therapists do as well. We make we try to help you accommodate to the best of your ability with your disability
Hmm.
through modifications and adaptive tools and skills.
Yeah, Christy, to be honest with you, like when my dad had a trach put in, it was like confusing to me because I know my brothers are in the medical field, but when they kept saying occupational therapy and physical therapy, I got, I mean, they kind of go hand in hand, I guess, and it was very confusing to figure out which is which. So,
So the occupational therapist would probably be the one to help him like learn how to clean that area and stuff every day, when to be able to be as independent as he can with that
hmm
that part of his disability that's left.
hmm
Whereas a respiratory therapist might have gotten him where he went, got him to maybe, they take care of it when you're in the hospital. Okay. And then they're supposed to teach you how to take care of it going home. But then sometimes you need occupational therapy that can also be addressed in occupational therapy. So it kind of, all the ancillary services is what we call them. That is, respiratory therapy, speech therapy, physical
hmm
therapy, occupational therapy, and all these therapies go together in a sense. Always they tie hand in hand at one point. So an occupational therapist could work with, like a CP child on a horse,
hmm
and it kind of the gait of a horse mimics the gait of a child, or a
hmm
person, I should say. So it's called hippotherapy. So it's a really cool field that is very selective in equestrian centers and stuff.
hmm
You'll find it's very select, and it's kind of quiet and just kind of one-on-one, usually not a lot of people around and stuff. And you have, one horse and a therapist and a child and maybe a trainer or somebody that's walking on the other side of the horse. And it's really cool. It's called hippotherapy. And then of course you have home health, where the therapist goes into your home every
hmm
day. And then you have therapy when you're in the hospital in a critical setting, like you said, like maybe all they need, they go in and they take you're bedridden and you can't move at all, like you have a spinal cord injury.
hmm
So they go into your room and they range your shoulders every day, and they bend your joints and make sure you don't get contractures, and they splint your limbs so that you don't have further contractures months and years down the line when something could come back. You don't want to have the inability to move your fingers because the first therapist didn't address that. So, and then you move from a critical setting like that to maybe like a long-term acute care facility, and then you're dealing with, the same kind of things, kind of like kind of critical areas where they can't get up and move around, go to the bathroom without your help or something. They need assistance with that at all times or something because they fall or something. Who knows?
Yeah, it just seems
So
like it's
there's
all this stuff. It just seems like all this stuff is kind of complicated.
it's not complicated. It's just every different settings and different, steps, of care and level of how you're doing. So, but once you usually occupational therapy, when you really think about occupational therapy, most people think of, you're in the hospital dealing with strokes or any kind of cognitive issues, or you
hmm
think of dexterity issues and stuff like that.
Right.
But we help you like learn how to make a sandwich again. If you have
hmm
cognitive issues, we help you we there's just a number of things that occupational therapy assists with. But my my area of expertise
I
has
was going
the
to ask you
entire
that.
time been in hand therapy.
Uh-huh.
I'm a hand therapist. I'm a certified hand therapist,
Hmm.
which means basically you had to treat a certain amount of number of hours or years, and then you had to pass a very, hard test and pay,
Right.
you know, a substantial amount of money and to take the test. And um, I was lucky enough to be one and done, and studied a very long time, probably like 10 years for it. So by the time I took it, I was ready. So, but I had been doing hands for a long time already. I've been doing hands now for about 25 years. So
Wow.
hand therapy,
So
yeah.
is that like a specialized field in occupational
So that
therapy?
is another like specialized field, kind of like hippotherapy is a specialized
Mm.
field, but you can actually get a certification in hands. So it's for certified hand therapy. So um,
So
like
what kind of patients do you guys have? Like people that have
so I get a lot of patients from like orthopedic surgeons.
mhm,
So we treat and really see anywhere from the shoulder to the fingertip. So I
mhm,
see if you break your shoulder,
mhm,
or if you have a shoulder replacement because your tendons didn't work anymore, so you had to go to an
wow.
alternate, way to move your shoulder.
Mhm,
I see, rotator cuff repairs and labrum repairs, and I see nerve injuries of all sorts from all levels, from the shoulder to the neck down to the fingertip. I deal with, arthritis. I deal
mm,
with lateral epicondylitis, tennis elbow, medial epicondylitis.
mhm.
I deal with, finger fractures, amputations, nerve lacerations, nerve
Wow.
repairs. So, bone repairs. So, we make orthopedic splints, or we call them orthosis.
Mhm,
So for the patient to wear to can keep them from getting contractures, or to protect their hand, or to keep their tendons in a certain position while they're healing, or whatever the case might be. So we have to know certain protocols and certain, ways of each doctor wanting things done, and to be very careful. We have to have very close communication with the surgeons at all times, and it's very challenging at times. So, but I love it.
Believe it or not, I was going to ask you that question about what is the most challenging thing about your job?
Probably, honestly, the physicality that's involved in it, because I could be dealing with a shoulder, so
Mhm,
that you're trying to rehab. And my forte with therapy is, as a certified hand therapist, is a manual therapy.
mhm,
So where I'm physically laying my hands on you, trying to move your joints, trying to bend, trying to move
mhm.
the joints gently, trying to push them in certain directions to facilitate healing and movement. So, if you have a 300-pound person on the table and you're having to put your hand in their armpit,
That gets to
and
be
push it around,
all right.
that's the challenging part. And that working with many multiple, ethnicalities and different, ways of living, and some people have different hygienic standards in the
Right.
Sugar Land area. So,
Right.
that can be challenging at times, and you just have
Right.
to kind of muddle through it and be kind about it and to work past it. But no, but that's in the just the sheer number of patients that I have. It's very hard to juggle multiple patients at one time all day long. But it can be very challenging, but it's very rewarding at the very end of the
So how
day.
many patients do you see on a single day? Like,
I see
that,
probably anywhere from 10 to 13
oh,
patients
that's a
a
lot.
day.
Wow.
Yeah, it's much more than my last job. So, but I really, really enjoy it. So,
So, Christy, let me ask you, are there more women as occupational therapists as opposed to men, or is that not a
Probably,
big deal? Or
yeah, no, there are more women as occupational therapists, and there are more men in physical therapy. Um, but in physical therapy, it's probably, I'm taking guess, don't quote me or anything, but I would think it like 60-40 or something. There's a lot of women in physical therapy too. But in occupational therapy, it's probably 70-30, maybe even less, 80-20, female to men. So it's in occupational therapy, it's a lot more women, I would think. There was in
right.
my class anyway. So, but in my job, my boss is a male, so that is it's interesting to have that. So,
So you
and
guys can
he's
actually
an
work.
occupational therapist.
So you guys can actually work for hospitals, or you can work on your own. There's many different places that you guys can work, right?
Yeah, as long as you have your license and you can bill insurance, yes, you can. But you just like anything, it's a license that you can get taken away at any time should something happen. Like we were just talking about the other day that if you got into a car accident because you were drinking and driving or something, that would
Hmm.
you'd lose your license forever. So
To
the
get a
fact that
license, is it pretty rigorous? I mean, the testing is pretty.
yes, it's rigorous.
Is it? So it
it's
requires what, 4 years of college, and then what?
Well,
What?
first of all, when I graduated, it was a bachelor's degree. So there is 25 years since then. Now it's a doctorate program, doctorate.
Wow.
So, the process of going through all that, it is rigorous. To get into PT school, you must have a 4.0. You must
Wow.
have it, or else you're not going to get in.
I didn't
And
realize it was
you're
that.
competing with
Wow.
hundreds and hundreds and thousands of applications. And
Mm.
the same thing for OT school. Each probably school gets like 400, 500 applications
Hmm.
at times throughout the years. So it's very, hard to get in. And then the schooling is hard. Gross anatomy, that was hard.
Yeah.
um, and um, and and then passing your board and getting your license. I mean, that was rigorous. So, but and then, all the lifting and bending and stooping you do over the years with, lifting people and, transferring people. And if
Hmm.
you're in that field and if, as a hand therapist, you're hunched over a table the whole day and you end up with neck problems at my age. And uh, seriously. And
So, what,
you know,
what what would you tell like a younger person that wants to, like a younger female that wants to do what you're doing? What would your advice be?
my advice would be to study hard and get good grades because
Hmm.
you're competing with hundreds of people to get in.
Hmm.
Then once you do get in, or you're trying to get in, you're trying to get into, let's say, OT school.
Hmm.
Like I'm helping technicians throughout my career, think outside the box to try to help them to get them into school. So you try to volunteer. They tell you to volunteer. They give
Right.
you a minimum of what you need to do to observe. They call it observation hours. Well, they want you to observe like 20, 40 hours, but I mean, all reality, you should observe hundreds of hours, probably more like 120 hours at least.
Wow.
And make it in different settings, like when you're in hippotherapy, when you're in the hospital, if you can get in, when you're in an outpatient clinic where people come to therapy and they leave and they go home, when you're in the system, when you're in a hospital, like a hospice situation, maybe,
Hmm.
you to get into different situations and different settings to help you to understand fully in wholly holistically,
Hmm.
what occupational therapy is all about before you get into it. And that's what then broadens your scope and you have more to talk about during the interview process. and you have better things to say when you to put down on your essay application that you're trying to even get them to look at you in the first place. So that would be my advice. So, and then once you get in, you study hard, don't fail out, because it's you work so hard to get you there, and you better buckle down and start studying. So, and then because the rest of what you're learning is going to be for the rest of your life, and try to kind of remember everything as you're going through it, because you're going to have to get tested to get your license then again, and remember every single thing you just learned for the last 3 years to get
Yeah.
your doctorate, and you're going to have to write a capstone and all this, and have just so much more to get a doctorate, and then you get a doctor behind your name, right? And then people start calling you doctor. I want to see Dr. Chapman or whatever.
Hmm.
And, and they go, oh no, I want to see this person over here, because they have a doctor behind their name. But yet you have this person over here that doesn't have the doctorate behind their name,
Hmm.
that has 25 years experience. Which one do you want to go to? The one that has the 25 years experience, or the one that just got out of school and has one doctorate behind their name?
Right. Right.
So that's my school of thought, on that, about patients or people, the public choosing, therapists. You really want to choose your therapist based on the number of years they've been in practice, and what kind of courses that they've gone to, and how many letters behind their name.
Right.
Because the ones with a lot of letters behind their name, they've studied on and on and on and on throughout their career to continue to put those letters there. And so,
Yeah. Believe it
yeah,
or not, Christy, I think to me, with my dad's situation, it was very confusing, the terms between occupational therapy and physical therapy. But I really appreciate you trying to clarify that.
yeah.
What?
So once the occupational therapist goes to your room, and the first thing they teach you how to do all these things again, and then they sit you down in the chair, and then you waiting for the physical therapist to come and put the gait belt around your your waist,
Your waist.
and then to help you walk, to the treatment room where you're going to work out your body physically. So that's the way I always like to tell people the difference between occupational therapists and physical therapists. We're the ones getting you prepared for the day, for in the morning with your ADLs, before you go and work with physical therapy on your body and your physical, capabilities. So
Believe it or not, all this stuff is very interesting, right? I mean, you don't realize all this stuff is so involved unless you talk to somebody.
yeah.
Yeah. Anyway,
Well, I'm glad
Christy,
to help.
was there anything else that you want to that we didn't cover? I think we covered pretty
No,
much everything.
yeah, yeah, it's great. I hope
Yeah.
you learned a lot.
Okay. Thank you.
You're welcome.
If you guys want to reach me, my email is grabbingcoffee with ARUN at gmail.com. Was there anything else, Christy, you want to say? Or
No, thank you for having me.
okay. Thank you. See you later.
You,
Bye
bye
bye.
bye.
Bye.